All right. Well, people are coming in the virtual door. I'm just going to start us off in the interest of time. So welcome, everybody. I'd just like to start by saying that the WHRI would like to acknowledge that we are uninvited guests on the unceded ancestral territories of the Musqueam, Squamish, and Tsleil-Waututh Nations. And as a provincial research institute committed to improving the health outcomes of women, including those across the 2SLGBTQIA plus spectrum, we recognize our responsibility in the collective effort towards establishing culturally safe healthcare systems and services that address the health inequities among Indigenous peoples, especially Indigenous women, girls, and Two-Spirit peoples. And we encourage all people involved in research to read both the Truth and Reconciliation Commission of Canada Calls to Action and the In Plain Sight report, and reflect on the ways that we can incorporate the recommendations into our work. And as we gather in spaces together, we encourage you to reflect on your positionality on these lands and your personal commitments to reconciliation. So with that, I am very pleased to be able to introduce our round speakers for today. Dr. Beth Payne is the project manager for digital health research at BC Children's Hospital Research Institute and the WHRI, and a research associate in the School of Population and Public Health at UBC. Beth brings 15 years experience as a research program manager and academic in the fields of global health and digital health focused on maternal and child health. She is very well versed in research project management, partnership development, user experience design, health systems research, and implementation science using mixed methods. She has published over 75 peer-reviewed papers with over 3,400 citations. And Sally Chen is the Digital Health Research Coordinator at BC Children's Hospital Research Institute and the WHRI. She holds a Master of Food Science and a Bachelor of Science in Food, Nutrition, and Health from the University of British Columbia. With a diverse background, Sally has managed national health projects, supported provincial public health initiatives, and led a municipal health and wellness program in her previous roles. In addition to her broad experience, Sally is proficient in communication, project management, UX, UI design, responsive design, wireframing, prototyping, HTML, CSS, and some JavaScript. It's very impressive. And Heneen Hamhaz is a project coordinator at the Institute of Global Health, supporting the Smart Discharges project. She first joined the BC Children's and Women's Research Community as an MPH practicum student with the Digital Health Research team. Heneen is passionate about advancing innovative healthcare solutions for equitable health to care through global collaboration. So I would like to welcome our presenters and turn the floor over to them.
Thanks, Catherine, and thank you all for joining us bright and early on a Friday morning during the spring break. We're really excited to come present to you today. Heneen, Sally, and I worked together when Heneen was still with us at the Digital Health Research Program on this project over a number of years, and it's great to bring it to this community because it's our hope that you'll really take the learnings from the RAPID project, which stands for Research Agenda for Perinatal Innovation in Digital Health, and move some of these identified research priorities forward. So next slide, Sally. Catherine did a land acknowledgement, but I wanted to make sure I also added to what was said, because I myself am joining from my home, which is on the unceded and ancestral territory of the Shishalt Nation, in an area of BC that's colonially known as the Sunshine Coast. And this project did have a provincial focus where we engaged community members from across BC. And so I wanted to extend my acknowledgement and gratitude to all of the First Nations communities, which are quite diverse across our province, and whose communities we hope to engage and partner with as we move this work forward. So next slide. We have a few specific objectives for the presentation today. Obviously, present the findings from the RAPID project, but we also want to provide an example of how we use human-centered design to approach defining research priorities. And most importantly, we see this presentation as an opportunity to mobilize the research community and are approaching it as a knowledge mobilization opportunity. And so we do have for you at the end of our presentation about the agenda itself, a bit of an interactive session where we're going to ask you some questions before there's an opportunity for you to ask us questions. So please be prepared for that. We would really like the WHRI research community's input as we try to move this work to the next stage. Next slide. So to start us off, I thought I'd ground us in a definition of what is digital health. The PHSA has a definition for digital health that we've adopted for our program, and that is digital health is an all-inclusive term used to describe the use of information technology and secure communication tools, services, and processes to support an integrated healthcare system for the benefit and well-being of all patients and healthcare providers. And so what this means is digital health in this context is really focused on transforming the healthcare to improve either access to care or quality of care with a focus on patients and care providers. Some examples of digital health, just to clarify further, things like personal health records, use of virtual health technologies, apps and websites to support self-care, remote monitoring technologies, AI, and that sort of thing. So that's what we're talking about today. Next slide. The RAPID project itself came together based on a number of enabling factors. And so the project was a collaboration between WHRI and BC Children's Hospital Research Institute with a number of other partners. And when we started, we did complete a literature search to understand how digital health is currently being used in perinatal care. And there's a number of there's a growing body of research in this space I'm sure some of you are familiar with, but in particular, there's a number of areas where there's been quite a lot of success in using digital innovation to support improvements in care for patients in some of the areas here and improving health outcomes such as lower and healthier gestational weight gain, lower smoking rates, increases in physical activity, and improved outcomes. And then for care providers in the health system, there's evidence that digital innovation can reduce workload and improve decision-making, and as well as reduce unplanned and need for planned healthcare visits. Next slide. So along with that growing body of evidence, more locally, some of the things that were happening that we are aware of or part of as we started this project. As a digital health research program, one of the things we do regularly is try to connect with the research community and understand barriers and facilitators to success of digital health research, both at BC Women's Hospital, but across the province. And we had done a number of surveys and interviews with researchers, and a few things that came up very strongly as needs or important facilitators to research success was the importance of organizational and health system leader support for the different programs of research and the priorities that we were targeting, as well as the importance of having a strong multidisciplinary team working with people with lived experience as you're developing digital health research projects and trying to implement changes with digital innovation. Alongside that, we partner quite a lot with different groups across PHSA and the province to understand what upcoming priorities are from the provincial lens. And another enabling factor that led to the RAPID project is that there were new strategies being published by the PHSA or the province, such as the BC Digital Health Strategy and the Maternal Services Strategy. And those all came together to motivate us to initiate this project. So next slide. And what the RAPID project was itself, it was an set of activities where we wanted to bring together all these key partners and communities to facilitate activities that allow us to share knowledge and and come up with research priorities and research questions that would move digital innovation forward. So we had three specific objectives. The first was to identify gaps in the perinatal continuum of care that could be addressed with digital innovation. The second was to define current barriers to optimal adoption of digital health interventions in perinatal care from both patient and health system perspectives. And then finally, to come up with this research agenda and a set of priority questions that we could try to address then move digital innovation forward and address some of these identified barriers and support better care. Next slide. So as I mentioned, there's a set of activities. We did a number of different activities, and we'll try to go through them in as much detail as we can in this short presentation. I already mentioned we started with a literature review, but initially we met with each of our identified partner groups individually and completed activities to engage each of those groups' ideas and thoughts around what the needs for perinatal digital innovation are. And then at the end, we brought all those groups together to build consensus on what those priorities should be. And so we'll go through each one of these in some detail. And rather than give you all the methods at once, because it is such a diverse set of activities that were completed, we're going through section by section and going to present the methods and then the results and then all of it together at the end. So next slide. So I'm going to start with the first couple sets of activities and then hand the floor over to Henning and Sally for the bulk of the rest of the presentation. So the first group that we engaged with were health system decision makers, and this was partly through our project governance model, which included forming a steering committee that had representative leaders from all of these different important partner groups that contribute to perinatal care across BC. That included our two research institutes, WHRI and BCCHR, but also Perinatal Services BC, some Faculty of Medicine representatives and additional researchers from outside of our institutes, as well as a number of folks from groups at PHSA, such as the Office of Virtual Health, which is now Provincial Virtual Health, as well as other groups at Provincial Digital Health and Information Services. Next slide. And because of the representation of the steering committee, what we did as a group to start the project was to review those strategies that I mentioned at the beginning. A number of our steering committee members were very actively involved in developing these strategies. And so we had an in-depth discussion around the process of coming up with the strategy document, the type of background evidence that was used to inform the strategy, and then where there might be gaps and opportunities for additional research, specifically in the area of perinatal health to move the strategic goals forward. The BC Digital Health Strategy itself has 4 goals. Those are to empower patients, improve provider experience, establish connected healthcare system, and enable the business enterprise. And the opportunities that came out of this discussion were really in a couple of areas. Those were around remote patient monitoring, virtual health, and connected care. And so some of the questions that the digital health strategy group posed to us as research priorities from their perspective were, what is the best way to use telecommunications and information technology, so virtual health, to provide healthcare services during pregnancy and childbirth remotely? There needed more evidence around that. What is the best design and implementation strategy to enable a shared electronic antenatal health record so that healthcare information can be shared better between different providers as well as the provider and the patient? And then the other big focus was, is there opportunity to validate wearable devices that can better track and monitor health during pregnancy and childbirth and allow more efficient remote monitoring for conditions like gestational diabetes and preeclampsia. The next slide. After reviewing the BC digital health strategy. We went through with our partners at Perinatal Services BC, the maternal services strategy, and some of the gaps that were identified through the development of this new strategy and where the opportunities were there. And similarly, the the nice thing about this process is that there were some clear overlaps in what the two groups felt were needed across BC that we could bring forward into the next stages of our work. Again, opportunities here were around long-term monitoring using remote monitoring technologies. But there is a greater focus with the PSBC group on looking at more research on how technology was impacting health equity around the province, as well as more policy-based research. Next slide. So once that was done as a foundation for some of this work, we went on to complete activities to engage with perinatal care providers. And this included nurses, nurse practitioners, midwives, physicians, and allied health. Next slide. And we did this engagement through something called a thought exchange. If you haven't heard of this before, thought exchange is an online platform that allows you to pose a question, and then people can anonymously go and put responsive thoughts and rate each other's thoughts. And so through doing that, you are able to prioritize needs and ideas from the community you're targeting. So we put out this thought exchange and advertised it quite broadly to groups like the BC Midwives Association, Doctors of BC, Family Doctors of BC, all the different schools across the Faculty of Medicine at UBC, and a number of other groups and provincial listservs through all the different regional health authorities. This was one of our most limited engagement strategies. Although we had 125 participants come in, only 55 provided thoughts. So it wasn't quite as successful as we hoped, but we did have representation from every health region across BC in this response. And so it's a geographically diverse group, and it was also a mix of different types of providers, and so that speaks to some of the quality. Next slide. And again, from that, we had a set of ranked thoughts that came out of the engagement with the care provider. And some of the key findings that we were able to draw from that is, first of all, the care providers that responded did not mention many digital health tools at that time that they found to be really valuable to their work. So there's clearly a lot of opportunity for innovation. The main things that were mentioned were things like Zoom for virtual health. This engagement happened about 2 years ago, so hopefully there's been some shift in this. But at that time, there wasn't a lot of thoughts shared about how valuable digital innovation was to providing care in the perinatal space at that moment. And so from that, a lot of the thoughts really highlighted that more innovation was needed. There was also a big focus on should we move any of this research forward, it really needs to be patient-centered and ensure that it's inclusive in design. The clinical areas that came up as the greatest need for digital innovation were actually postpartum lactation support and mental health services, with a focus on rural health. And then the other comments that were highly ranked were around need for better communication systems to allow communication between providers, but also providers and patients. So again, the connected health system concept. And then finally, the other one that was really highly ranked and came up repeatedly through those few thoughts was that a real gap in our current ecosystem for digital health in the province is that there is no provincially standardized and free prenatal patient education. And I think I can see at least Jenny, who's kindly got her video on, nodding her head. So that one was very clearly echoed by our patient partners, which we'll talk about later as well. Next slide. And so with that, I'm going to hand the floor over to Sally and Haneen to talk about the really bulk of the work that we did, which was engaging with patient partners.
Thank you, Beth. For everyone who is the first time join this rapid project presentation, I put our rapid paper link as well as our rapid summary overview on the WHRI website link in the chat. So feel free to read it later on. But like Beth said, we have conducted a series of activities with different stakeholders. So in this session, I'm going to, move on to this part about our engagement session with our patient partners. So our patient partners come from diverse cultural background, although we only have 4 patient partners, but they do speak different multiple languages like Mandarin, Cantonese, Spanish, Arabic, because we want to ensure our patient partner groups, they can reflect the diverse British Columbia population as much as possible. So we conducted a series of interactive human-centered activity with our patient partner to demonstrate the value and the importance of applying human-centered design on patients in healthcare. And for those who didn't join our previous, launch and learn presentation, I'm going to talk a little bit about, first of all, what is human-centered design? So according to the Interactive Design Foundation, it is a non-linear iterative process that our team or everyone can use to understand the user, their challenges, assumption, redefine the problem, and create an innovative solution to prototype and test. Like we need to think from their perspective, like what do they want? What are their needs? The research we are conducting should not only driven by like technology and data, but also by the preferences and needs and experiences of human in this healthcare industry is our patients. So we can create, solutions that are responsive to them. And through this approach, we can bring new aspects into consideration, revealing unexpected features and capabilities for an innovative solution. And like I said, I'm not gonna go too deep into this, but human-centered design process usually under this big umbrella, there are 5 stages, and remember this is not linear, so you cannot call this like first stage, second, and the third. I will just refer this as one stage. In this stage, emphasize we usually need to ask questions about our target audience, in order to understand their needs better. You can ask who they are, what do they prefer, what approaches work for them, and then the audience should include all the stakeholders and partners in this case. And in the define stage, other researcher, stakeholder, and partner, they really need to have a clear and deep understanding of the problem that we are trying to solve in order to have effective generate insights into solution. And in the ideate stage, usually it's everyone just come together to generate as many ideas as possible that focus on the objective of our research. And in the prototype, as it's just now after we have all those ideas, it's the time to evaluate, those ideas, and we select just a couple of them that best address our objective and develop them. And then in the testing stage, it's the opportunity for us to test okay, is our solution really feasible? You can test with the audience to get their feedback and make adjustment. And like I said, it's not linear. So you can go all the way back and you can go from the testing back to the emphasize. So this is important to remember, human-centered design is more cynical and adaptive process rather than just a step-by-step, progression. It's not like a waterfall methodology, so that we can ensure, the solution we created truly user-centered and effective. And for our project, our rapid project, we focus on identify the gap priority areas for future research so that we were primarily focused on the emphasize and define steps. However, like I said, this could continue past that. We could take those research questions based on the priority gaps in the perinatal care and start to research and develop possible solution, testing out those solution as well. So really this methodology can apply to, all other research projects or goals. It depends on what you need. And our project just focus on the emphasize and define, and your project might focus on the ideate, prototype, and testing. So my point is you can always adapt and apply, based on your goals, as long as it remains true to the core component. Finally, let's go into our patient engagement overview in this project. This is just an outline of what kind of activity we did. You can see there are 4 sessions, and in each session, we have its own objective. We have the pre-session activities, and we have the session activity. So there are a lot. And the activity were all carried on something called Miro. It is an online interactive workspace, where user, patients, we can all come together to create and share and manipulate a visual asset in real time. And for example, some activity we conducted are, empathy map, user journey, and insight statement workshop. And to save time, I'm not going to go too deep into the methodology, of each those activity, because as I said, we have previously presented in the launch and learn that you can find on the WHRI website as well. But it's important to know, our goal for those activity is really to create, a community-centered, environment that our patient partner, they can feel comfortable to share their thoughts, their experiences, with us, so that those activities listed here are just a way to facilitate and understand what our patient partner's journey look like. I would just give a quick example. For example, in the empathy map and user journey, those very simple visual engagement tool, we just invite patients to take us on their journey so we can see their health experiences and health systems, and listen and learn directly from their stories, their feeling, their hopes, their needs, what are their pain points, what action did they take, where did they struggle the most, and what are they scared of. And then there are a lot of opportunity will come up after those sessions, what improvement can be made based on their experience and what can be introduced. And in the last session, which we will discuss them later in the next few slides, we reflect on the summary of everything what Beth mentioned: the thought exchange, the maternal service strategy report, the BC digital health strategy report, all of them, to identify the recurring themes, the priority, and the gaps that were also expressed by our patient, which were then we will talk later on in a master list of insight statement. So from all those activities we conducted, we have found the common challenges were experienced among all patients actually is about navigating the perinatal period. So for example, all the patient partner, they talk about, the difficulty, the challenge in understanding the different types of perinatal care providers. They don't know how to choose the right one, how to find an available midwife or doctor in their region is also a problem. They also all spoke of challenges in navigating the transition from the early pregnancy to early newborn care, particularly when, their concerns non-urgent about their baby, but then they found our available health care resources, they focus too on the urgent and emergency condition more. So that's a part it's really a concern. And the conclusion we made overall those 4 meetings I mentioned earlier, they all clearly like express that they wanted digital innovation that would support their confidence and ability to navigate the health system in all our regions. Here, BC, well, our healthcare is currently distributed but often fragmented. I will pass this to Haning to talk about the master list of insight statement from now on.
Thank you, Sally. And so Sally and Beth went over all the activities we did to engage with our different partners separately. And so the next step for us was to bring all the findings that we generated together. And so, as Sally mentioned, in our last patient engagement activity, we had the patients develop insight statements. And insight statements are a way of concisely summarizing a key finding into a single sentence. And so in our case, we asked patients to reflect on the pain points and barriers that emerged during all our patient engagement meetings, and then develop insight statements for those pain points and barriers. And so each statement developed identified a single pain point, who it was experienced by and how it impacts them. And then so we also wanted to use insight statements to summarize our findings that we had from the previous activities. And so we used the statements generated by the patients and deductively analyzed all our findings from reviewing the health system strategy reports, the results from our thought exchange and engaging with care providers, as well as like our reflections of the patient engagement meetings. And we reflected on all of that and synthesized and added to the existing patient insight statements. And so this left us with what we call our master list of insight statements, which was also reviewed by our patient partners before we moved forward with it. Next slide, please. And so before moving on to our final activity, which was a workshop, we analyzed the insight statements step further and grouped them into 6 overarching categories to make them easier to process and digest during the workshop, because many of the attendees would be seeing them for the first time. And so I'll go through each of the categories and read out an example of each of the insight statements within each of the categories. But if you're interested in reading our full list, that is included in our rapid publication. And so the first category is education or health information. And so this category includes statements that focused on issues patients face with the availability, accuracy, clarity, and accessibility of information. And an example insight statement is patients who are accessing perinatal care are overwhelmed by navigating an abundance of resources, and they are not sure which ones are accurate to follow. The next category is navigating health systems, and this and the insight statements within this category focused on difficulties patients experience in utilizing perinatal components and processes of the health system. And an example insight statement is patients are navigating aspects of the healthcare system during their perinatal journey that they have never had to use before. This often comes with little guidance and doubts about what steps need to be taken. The third category is patient empowerment, and this focused on situations throughout the perinatal journey that left patients feeling helpless and stressed due to a lack of involvement in their own care or receiving dismissive care. And so an example statement is patients feel uninvolved in their health because they're often told what to do without direct and clear explanations or guidelines from their providers. Next slide, please. The fourth category is decision support, and these were challenges patients faced in making informed decisions about their providers and treatment options. And an example insight statement is patients are confused about when to choose a midwife or other type of doctor and why they may need to switch providers during pregnancy. The next category is community or peer support, and this refers to the informal networks that perinatal patients access for information that can sometimes be conflicting. And an example statement for that is patients often rely on informal peer support, which adds to the conflicting information they receive, leaving them more confused and unsure of what information to trust. And the last category is connected systems, and statements within this category focus on the lack of coordination and communication within different parts of the health system that are impacting the patient continuity of care. And an example insight statement for that was patients have to manage multiple appointments with different providers instead of integrated care team, meaning that they often wait long periods of time before their needs are addressed. Next slide, please. And so for our final activity, we wanted to bring together all the partners we engaged with. So this includes clinicians, health system partners, patients, and researchers. And we held a workshop over Zoom, and we had all the attendees discuss the list of insights as well as potential research questions in order to align on the challenges and priorities that need to be highlighted within the research agenda. And throughout conversations during the workshop, the attendees emphasized that for the actual development of the research questions, they preferred having broader transformative goals rather than specific clinical concerns to ensure that the agenda can be applicable across the different health settings in BC. And the group also emphasized the need for foundational research on effective digital health resources before proposing actual specific solutions. And so from our discussion, three main themes emerged, and these are patient autonomy and support, educational resources for patients and providers, and access to health information. And so these 3 themes were used to help organize our 12 resulting research questions. And next slide. And so our first theme, theme 1, focuses on supporting patient autonomy throughout the perinatal period. And so the questions within this theme revolve around identifying and developing digital tools that can help patients in their decision-making or connecting them to the appropriate and reliable resource. They also include exploring strategies for monitoring and addressing and administering different aspects of patient care, such as patient mental health, to provide timely support and as well as improve health outcomes. And the next theme focuses on ensuring patients have the right information and resources throughout their perinatal journey. And so this includes developing starter kits, identifying barriers to multilingual perinatal education, understanding patient preferences for accessing health information, and developing strategies to ensure patients can be connected to these tools and resources. And then for our final theme, the questions centered around access to health data. And so this included exploring the impact of transparent provincial dashboards and examining how integrating patient-reported outcomes into medical records can support shared decision-making. So now I'll pass it on to Sally, who will highlight some of our key takeaways as a project team.
Thank you so much, Henning. So yeah, as you can see, we really have established a lot of different activities. And then from all those activities, there are 3 takeaway messages, which are less is more. We need to make sure to give patients enough time to share their insights, allow them, to share their experiences with each other, as it can lead to deeper understanding and valuable insights. And we also need to keep in mind that, sometimes some idea may not be possible maybe with our current technology now, but at the time, technology can also offer a solution that patient might not even know exists or may not even think of. And then to save the time, and also I'm not gonna play the video here, but to respect our patient time, when we were conducting the rapid project, we invited them to share pre-recorded videos about their perspective and experiences on this project, to share their stories, such as like why you want to join our patient partner group and what are your key takeaway from our weekly planning meeting and workshop, and what is your overall experiences with our rapid project. It's only like an 8 minutes long video, so we encourage you to all, like if you have time, scan here. You can watch it on our website, so to know their stories. And we only have 20 minutes left, so without further ado, we have a Mentimeter discussion time. So everyone, if you can just scan here or just go on mentimeter.com, use this code. I'm going to share the screen again and put the link in the chat. So we have a couple questions for you to answer. 1 second.
Thanks, thanks, Sally and Henning. So we hopefully got into enough detail about what the agenda actually includes for you to reflect. And so at the top of the screen, once Sally will copy the link into the chat, but at the top of the screen, you'll be able to see it's menti.com and the code will be there. Sally, you're just covering the code with your extra.
1 second.
There. So the code's at the top of the screen there. What we didn't explain is that once we had an initial list of research questions that came out of the workshop, we did actually go back to the patient partners to review that list again and make a bit of modifications to make sure we were really centering the patient voice as the primary audience of this agenda, and then asked the workshop attendees to actually rank what they thought was the priorities. But we wanted to take the opportunity, since we're connecting with all of you, the important research community, to also get your opinion. If you were to rank the priorities and the themes of the 3 themes of the research agenda, what would you say is the greatest priority for research right now to support better care in the perinatal period in BC? And I can see lots of responses are coming in, so thank you. And right now, the priority is focusing on patient autonomy and support when navigating the health system. We'll give this one just another minute and then we'll move on. I do want to invite anyone who's here, and a number of our steering committee members are here, to unmute yourself if you want to also comment on or ask questions about, as we go through this, about your responses. Jenny?
Yeah, I actually see all 3 as equally important. So my answer won't be helpful when I put them all in, but I honestly I can't see, and maybe that's just the way I look at it from a conceptual perspective, and what I will begin doing some work here in Vancouver, BC. So just to give context, I started my professor appointment at UBC School of Nursing, and this is my topic exactly. But I come at it from a very like I come discreetly from the patient engagement perspective and the concept definition of patient engagement. So all of these fit in top priority. And I guess my best answer, now that I, let that all out, is it's actually going to be the parents that tell us what is most important. But yeah, so that's my answer.
Yeah, and we did ask the patient advisory group their opinion around that, and in the paper we talk about the results of some of that. But like I said at the beginning, this is an opportunity we hope to mobilize you as the research community to act on some of these items. And I know we have a great group of partners that would be interested to see some of this move forward. So maybe we'll move to the next slide. One of the things we've been doing since this came out is trying to track what's happening in the research community to understand where work is happening that can actually address some of these needs and gaps. And we're aware of a number of really great research programs that are underway through WHRI partners, but also through PSBC and through the work of the PHSA and the BC Digital Health Strategy. We want to take an opportunity to reflect on this audience if there are things that you're doing in your work or you'd like to do that you can actually see are addressing some of these priorities. We'd love to hear about them. And it sounds like Jenny, you may have some work in this space. I know PSBC is working on some patient education, improved patient education resources, but there must be other things happening. And so I'll just give a shameless self-promotion here that the Digital Health Research Program at WHRI is our little team is available to actually support research as well. And so if you have ideas that you want to move forward that you think align with it would be great for you to reach out to us, and we'll see how we can find ways to support your work and move it forward, because we really want to see impactful change and improvements to care for perinatal patients. So this is great. Jenny?
Yeah, just wanted to clarify for those, it doesn't look very unrelated when you see what I have here. So I put this Ronald McDonald House in success, and that's because I'm beginning relationship building in the community level with parents. So from the community setting, but also in the acute setting at Surrey Memorial Hospital. And then I've connected with some physicians at Surrey Memorial Hospital and head of research. So we're just starting to build community so I actually will sit in that empathy and defining position for a while, just to set my work up for the next steps. But that's what mine is about there.
Okay, that's cool. And the partnership development is so critical, and it takes time to establish that. So,
And I don't want to be obtuse. I realize that your work was at that engagement that empathize and define stage, and it's amazing. Like, I'm so impressed with what you have here. It's so good for a jumping off point. But then I just come at it from a really discrete qualitative work in the beginning, and so that's why I'm sitting there, not to disregard the heavy work and lifting you've done at that stage already, but yeah.
yeah, thanks. Okay, next question. We want to have time to get through this. So the next question is just, what do you see that there's any gaps? And so, like Sally said, this is supposed to be an iterative process, and we want to make sure that we're routinely reflecting on what we learned and time has passed since we did this project. And so not only is there more work happening, as we just talked about with some of the projects that you mentioned, but there might be other opportunities or other needs that have come up. So, and yeah, that is one of the main limitations that we talk about in our paper, is that we did have a small patient advisory group. And so to move these research priorities forward, really a lot of additional engagement with patients needs to happen to frame what that ideate and solution development process would look like. And so, as we've talked about, this is really a first stage and an initial activity to try to stimulate ideas, but none of these should be moved forward without great engagement with more patient voices. And yes, I'm not sure if anyone wants to speak up, but one of the other limitations that we talk about in the paper is that we did not have very good engagement with Indigenous communities for this work. And so really the whole thing would need to be redone and revised with some acknowledgement of Indigenous ways of knowing and engaging those voices effectively. And that's something we would love to do, but we have not had the opportunity to do that yet. Okay, we'll move on. Olga, do you want to speak?
Hi, can you hear me?
Yeah.
Yes, great. Hi, I'm a researcher also from the School of Nursing at the University of Victoria, and I joined this group relatively recently, and I think it might be my first time attending a meeting like that. So it's very helpful, and thank you for laying out the process you have taken and the findings. So this is very clear and helpful. What comes to my mind in terms of what possibly might be missing is that the notion of connectivity and information and communication technology is known in the literature that it's heavy on its potential has been used mostly on the information side of things, whereas the communication is what you have highlighted as a piece that continually is brought up by all stakeholders as a very important, the two-way communication. And so communication then, connectivity involves the role of healthcare providers as well. And once digital tools are introduced into the healthcare ecosystem, it changes the work of the healthcare providers. It changes the workflows. It requires sometimes workarounds and so on. So this is another integral piece, understanding how the work of healthcare providers change and how to help healthcare providers to establish, to develop new ways, new processes, new care processes to now integrate another actor that is introduced, right? The technology that is introduced into this ecosystem. So that's something, and I will be reaching out Beth to you and Catherine, and we might have been in touch already in the past, but that's something that I'm starting to do in the maternity newborn program with some smaller nurse-led research projects, looking at how understanding how nurses work has changed now with the electronic health record, and what efficiencies have been achieved and what maybe has not, and there is a potential. So I just wanted to bring this another aspect of this work on the table. Thank you.
Thanks, Olga. Yeah, I know we have met before, and that is an important reminder. And it's not something that came out in our work so much, but when you are implementing a change, there's sometimes unexpected impacts that need to be monitored in terms of how the system changes so that healthcare providers, not everything will improve the work as you expect it to. We know from the introduction of the EHR, there's been some increased workload in cases for healthcare providers as you're learning to use the new technology, and it's not always as smooth and revolutionary and beneficial as you expect. So very carefully developing those technologies and monitoring the impact is always critical.
Exactly. And it's interesting that healthcare providers, I think it's not a black or white picture, right? There are some great things that are brought up with digital technologies, but also some unanticipated effects and some just new ways of working. And to achieve best outcomes, some unique supports, some small things, some tinkering that can be needed, which is not obvious, right? And so it's looking closer at what actually is being done and what happens in these processes, workflows, that some of these questions can be addressed. Thank you.
Yeah, thank you. Okay, we have one more question, and this is what we wanted to leave you with is we hope that you all can see yourself engaged in this work and moving the priorities forward. And so we just wanted to have a moment of self-reflection for us and for all of you, as you think through what these priorities are and what we drew from engagement with all the different partners across clinicians and other healthcare decision makers, as well as our patient partners, where do you see yourself in this work? How would you engage in this to move it forward? And there's some great examples coming up here about incorporating human-centered design. We'd love for you all to be advocates to share these research priorities through your networks and try to stimulate more research. And that's great. We have some patient partners on the line as well. And so if you do have thoughts on what came out of this agenda and reflections from your own experience, please share them with our team. And so again, we would love to hear from anyone on this in this group that is interested in working in this space and are happy to support projects moving forward. So please do reach out to Sally and I at the Digital Health Research Program, because it is our role within the WHRI to see this work moving forward, and we're happy to support different research teams however we can. I know we didn't really leave any question time, but there was a bit of discussion there, so.
Absolutely. And I just want to draw people's attention to the comment that Rosie put in the chat about an upcoming CIHR funding opportunity for a Pan-Canadian Perinatal Mental Health Research Network. So just anybody interested in that space, definitely get in touch with Rosie. But yeah, if anybody has any other questions or comments, please go ahead and unmute yourself or raise your hand.
And I did have a final slide that acknowledged all the patient partners and our steering committee members and the funding from Michael Smith, which we won't show, but I just want to say it out loud that this was an incredible group that worked on this project together, and we're representing them, but there we go. But I just want to say thanks to all of you for supporting this. Thanks, Catherine.
Yeah. Any questions? Anybody? We have a couple minutes for questions or comments.
I had a question in the chat there. So I noticed that somebody put, they don't have to feel at all pressured, but somebody mentioned that they are a patient contributor and that they could be contacted anytime. So might be nice. I don't know if that's just directed to you as a group, but if they were comfortable sharing who that was, because your survey was anonymous. But that's okay.
Hi, that was me. I don't know if you can hear me, but so happy to share my insights with any of you. Yeah, I've just been sitting back and listening. It's been very interesting and also important for me to understand kind of what exactly I'm contributing to. So thank you for this presentation. And yes, it's an open invitation for anyone to contact me.
Okay.
I'm Karen Glansberg.
Yeah, do you mind placing an email in the chat? You
Oh,
don't
sure.
feel pressured
Yep,
at all.
no,
It's just, okay.
happy to do so. I'll do
Thank
that
you,
right now.
Karen. Okay, great. Yeah.
Hi, Karen. It's great to see you here. Yeah, thank you, everyone. And thanks again for inviting us to present on this work.
And I'm assuming, Beth, if anybody thinks of anything after we jump off, that they could go ahead and reach out to you or Sally for follow-up.
Yeah, please do.
Well, I'd just like to thank you guys for this amazing presentation. I know this was a huge body of work, and it seems, quick and easy when you summarize it, but I know it was a ton of work and effort, and it's amazing to see it represented here all together. So thank you so much, and I hope everybody enjoys the weekend.
Yep.
Have a great day, everybody.
Bye.
Thank you.